Welcome to the pelvis and thigh lecture. In this lecture, I'm going to talk about thigh and pelvis anatomy, injury prevention to this area of our body, and some of the injuries, the common injuries in the thigh and pelvis. As an FYI, the pelvis provides support between the lower extremity and the trunk, and the thigh is the area anterior to the knee and posterior to the pelvis. So our anatomy. Bones. Again, we have our femur, the big old bone in our thigh. Our pelvis, which I'm showing on the screen there, is made up of the ilium. That is, you can see on the screen, it's kind of the wing-looking part of our pelvis. The ischium is the lower part of the pelvis, all the way to about where the femur head is at. The pubis is the lower portion of our pelvis, so the pelvis is made up of three bones that when you're growing inside your mommy's belly, were three separate bones, but then as you matured, when you were born, they turned into one bone. So the pubis is this lower area with the holes in the bottom of the pelvis area. Then we also have the sacrum, which is connected to the pelvis. And so that would be, a lot of times, that's considered our back area, which we'll talk more about the sacrum when we get into the back injuries and stuff. And the coccyx is our tailbone. Again, typically thought about in our back. So our joints in our hip, we got the hip joint. That's the head of the femur. So you can see in the picture you have the ball of the head of the femur and the acetabulum. That's the area of the pelvis where the ball of the femur goes into. This is called a ball and socket joint. The range of motion here, the hip has a lot of range of motion, which I'll show in a picture in a little bit. And we have flexion, extension, internal, external rotation, abduction and adduction, and circumduction. Circumduction is when we can combine all those motions together. The other joint is the sacroiliac joint, is the sacrum and the ilium. There's not much range of motion here, but it does come up when we talk about pain in our lower back. So, all right, our hip range of motion. There's a lot on this particular screen. So I'm only talking about flexion, extension, abduction, and adduction. So we have hip flexion. Iliopsoas is a muscle on all the hip flexors are on the anterior portion of our body. Hip extension, there are hamstrings and gluteus maximus, which are on the back side or the posterior aspect of our body. Hip abduction or abduction, which is taking the leg away from the midline. That's our tensor fascia lata or IT band, which you talked about in the knee. And it's on the lateral side of our leg. And hip adductors is when we bring our leg in. That is our adductor magnus, longus, brevis. Those are three muscles: adductor magnus, adductor longus, abductor brevis. The gracilis and the pacnicius, those are their groin muscles, what are normally known as a groin, and they're on the inside of our leg. Okay, we're done with our anatomy. Now we're going to talk about how we can prevent thigh, hip, and groin injuries. Flexibility, there's a lot of ways we can stretch our hamstrings, our quads, our groin. So some of you may already know how to do some of these things, but if you don't, search on Google, you'll find and YouTube, you'll find great videos. I would recommend, if you are interested in this a little bit more, look at PNF stretching. Again, that's PNF stretching. That's a really great way to stretch our muscles. Proper muscle balance between our hamstrings and quads. This has been recommended for a long time. We should have a 3-to-2 ratio. So the quads should be 3 times stronger than our hamstrings, or a 60-to-40 ratio. So if your quads can lift 40 pounds or 60 pounds, sorry, your hamstrings should be able to lift 40 pounds. This may show up on an exam, so hint, hint. The other way is padding the thigh and the hip pads. By football, so usually at the college and high school level, you'll see all the different pads on the thigh and the hip. Conditioning. These are huge muscles. The thigh muscles are big muscles responsible for power and endurance when we're running and jumping and all the things we do in sports. And if we don't have proper conditioning, the muscle gets fatigued, and that leads to thigh injuries, especially strains. So now we're going to talk about some of these thigh injuries. First one is a thigh contusion or quadricep contusion. It can happen anywhere. It can happen in the hamstrings. It can happen on your hip. So a thigh contusion can be very disabling because all the muscles that are in that area. Again, we have a direct blow or many less severe direct blows being hit over and over time. So this is a nice picture of what it looks like with all that black and blue discoloration, ecchomysis. We do grade thigh contusions. It's a little bit different than we've done with the sprains contusions. Here we have 4 grades of thigh contusions. So grade 1, little or no pain, swelling, or point tenderness, and no restricted range of motion. So very minimal, just barely have a contusion. Grade 2, we started having a mild increase in our pain, swelling, and point tenderness. They're unable to flex their knee more than 90 degrees. So something to keep in mind, that our hip flexors and our knee extensors are the same muscles. So if our knee flexors also extend our hip. Grade 3, moderate pain, swelling, point tenderness, painful knee flexion at 45 to 90 degrees. And now they're going to walk with a limp. And grade 4, severe pain, swelling, point tenderness, and we may have deformity. Knee flexion is limited to 45 degrees. Again, this is for typically with a quad contusion. Our quad contusion treatment: ice with knee and hip flexed, like this picture is showing. We don't want the knee straight when we're icing the thigh, even with a strain. We don't want to use heat, ultrasound, or massage until the swelling has completely gone away. And the main reason why is because we may develop this crazy little condition called myositis ossificans, which I'm going to talk about next. So myositis ossificans results from severe contusion or repeated contusions over and over again, or strains, or we have mismanagement of contusions or strains. We don't pad the area, we don't ice it correctly. So here's a definition for this. When an athlete sustains a contusion or strain, a hematoma, which is a blood clot, is formed. If the hematoma is not managed correctly, the blood will crystallize and may calcify and turn into bone. So here's a picture of what I'm talking about from an x-ray, that you see the bones there. Then on the picture on the left-hand side, you'll see on the left of the femur, there's that ball of stuff. Well, that's the hematoma turning into a bone. This can happen 2 to 4 weeks post the injury. If the bone begins to form, it has to run its course. It'll have to be surgically removed. We can actually palpate the hematoma. It feels like like a rock. They're going to have severe decreased range of motion, especially with knee flexion, because you're stretching the quads, and extreme muscle weakness. The way to avoid this, almost every athletic trainer has been taught about this. We manage strains, thigh strains and contusions correctly by doing icing the knee on or the hip, the thigh, as I was showing you in the picture earlier, and pad it up. All those things that we need to do to make sure we avoid getting this particular condition. I can say that I've never had an athlete have this because I don't want to have anybody suffer this, because it is a bad situation for the athlete. Now we're going to turn into muscle strains. There's all sorts of muscle strains that can happen in our thigh. The quadriceps or thigh strain or a hip flexor strain. Usually we strain the rectus femoris muscle. That's the most common thigh muscle that gets strained. Again, a strain with a T is a tearing of tendon and muscle. So I remember the T for tendon, separate the difference between a strain and a sprain with a P. So the mechanism injury is just a sudden stretch of the muscle, fall on a bent knee, or sudden or forceful contraction. Hamstring strain, it's very common in athletics. Same MOI as quad strain, or stretching the muscle somehow. Usually, with a hamstring strain, we usually strain it with an eccentric contraction, which we haven't talked about in this class. This is when the muscle is lengthening, and that's for whatever reason. That is why or when the muscles tend to strain or tear. And then we have the groin strain. Again, this is another very debilitating injury. Stretching a muscle while running, jumping, or twisting with external rotation. So those of you who are into track, when we're doing hurdles, that is the hurdle motion. So again, we have 3 grades of strains, just like we have in the sprains, and we follow the same kind of format that we did with like the ACL sprain. With grade 1, we have tearing of the muscle anywhere from 1% to 20%. Grade 2 muscle strain is anywhere from 20 to 75% of the muscle is torn, and a grade 3 is the muscle is completely ruptured, cut in half. So as we increase the severity of the strain, we increase the severity of pain, swelling, and point tenderness. Excuse me. Excuse me. The person has less range of motion and strength, and we actually may have a deformity or a lump, and we definitely will have discoloration as it gets worse. And we typically use the Price method. Compression wraps help, which in this week you're going to learn about how to do compression wraps for this area of the body. Again, we'll follow the same steps that we did with the thigh contusion too. We ice, especially with the quadricep strain, with the knee flexed and the hip flexed or extended, sorry. Another pretty common injury in the hip is the hip pointer. So this is a contusion of the ASIS, which is the anterior superior iliac spine. That's the hip point. That if you feel on yourself right in the front of your hip, right in the middle of your hip, you can feel that on your pelvis. Or the iliac crest, which is, if you follow the ASIS all the way around to the back, that is the iliac crest. So this is very handicapping because there's a ton of muscles that attach here. And this is obviously, like most contusions, are from being hit by something. Usually for us, it's either in football, you're going to get hit by another player. If you're laying out in baseball to catch a ball. Basketball, you're going up for a layup and get undercut and you land on your hip. So there's multiple ways that you can hit this area. So we have immediate pain and muscle spasms with this. We may actually have temporary paralysis of the muscles. That means the muscles can't move. Again, it's temporary. It doesn't last a long time. The person may be unable to rotate their trunk or flex the thigh without pain. Now, these muscles, the trunk muscles attach to our pelvis. So that's why that happens. We can have alter walking or gait. Definitely will have discoloration a day or two later. And our treatment here is the Price method again. This takes a couple weeks for it to get better. We can pad the area for protection. Pretty common here. There's not much else you can do for it. I mean, it just takes time for it to heal. And that's basically all our common injuries in the thigh area and the pelvis area. So as a review, we talked about the anatomy, we talked about our bones and the pelvis, the sacrum and the coccyx. We talked about our hip joint and the SI joint. We talked about the muscles and range of motions, well, primary range of motions of muscles. The range of motion again at the hip is internal and external rotation, flexion, extension, hip adduction and abduction, and all those area muscles. Get my brain working. All those motions combined is circumduction. Talked about how we can prevent injuries. We talked about acute injuries, the different contusions, different strains. Talked about some chronic injuries. Myositis ossificans, our main chronic injury. And that's it for our hip and pelvis area.